Hinckley and Bosworth Community Hospital has set aside a dedicated ward to care for patients with the Covid-19 virus.
Hi, my name is Susanna. I'm one of the therapy leads at Hinckley and Bosworth Community Hospital.
Okay. And what's happening here at Hinckley and Bosworth Community Hospital?
So currently we have been preparing for Covid-19, particularly on East Ward. East Ward has been the designated ward for Covid patients.
My name is Karen Smith. I'm the Deputy Sister of East Ward at Hinckley and Bosworth.
And how's life on East Ward?
Life is very good on East Ward. We've got a really good team. We gel together well, and we feel probably quite more safe here than we do actually when we're outside.
Really? Why is that?
Because we've got all the preparations for the COVID virus. We've got all the equipment we need. We actually know that our patients are positive, so that we've got everything in place to look after them. And it's not such a guessing game as to know how to look after them. So it does make you feel more safe, because outside we're obviously unaware of who is positive and who is negative. So.
My name's Sue Barnett, and I'm the MAC that's on the ward at East Ward in Hinckley and Bosworth. We thought that we would have a tree to have some really good positive feedback for the staff and patients of how many people we were getting home. Some of them have left little comments for us, and some of them are just a date when they were discharged.
We've never had a problem with PPE. We've always had a full complement of PPE. When we've been running short, they've made sure that it's topped up. So never at any point we have had to reuse PPE. The only thing we do reuse is the goggles, which we are washed appropriately in between patients, and they're individuals, so everybody's got their own names on their goggles, so everything's in place.
Okay. You mentioned that the team was working well. You've had some additions as well. How have they been integrated?
So yeah, we did have some additions from Hinckley District Hospital, and we've also had some health visitors on the ward. The Hinckley District staff came first. They integrated very well. It was just a case of showing them how to manage the PPE, how we manage our patients, and it has been quite a learning curve for them, because obviously they do more day case and more outpatients, but they've integrated well, and our staff have made sure that somebody is with a new member of staff all the time, so they're sure of what they're doing and what to do with the patient.
So I'm Tracy Burrows, and I usually work at Hinckley District Hospital as a staff nurse on the day surgery unit.
And what are you doing here?
Our services at Hinckley District ceased due to the coronavirus and planned surgery being ceased. So we were asked to come here and help on the East Ward.
And how's that experience been?
I found it, I've tried to embrace it and use it as a learning opportunity for my own development and learn new skills. It's been very different, I do have to admit, totally different from what we normally do, but we're here, got on with it, and I'm enjoying it, yeah, I have to say I am enjoying it.
How did you feel when you first got told you would be dealing with COVID positive patients?
It wasn't a good feeling, obviously putting yourself in that situation, but I'm a nurse, and the patients here need to be looked after, and if that was one of my own family or a friend or myself, these patients still need to be cared for, so I've tried to do my best and become part of the team.
Okay. Have they done anything that's helped with your apprehension?
Yeah, the team have been really good. They've been very welcoming. They've tried to set up all the systems that we need to use, some taking a little bit longer than others, but the team are really helpful and have allowed us to come and join in, and yeah, I've not had any problems. I'm enjoying it.
And do you know why Hinckley and Bosworth was chosen to spearhead LPT's response?
So Hinckley and Bosworth were chosen, East Ward particularly, with its large bed-based capacity, with a number of side rooms with ensuite facilities, as well as piped oxygen throughout the hospital.
So it's quite a modern hospital, isn't it?
It is, yes. It's modern and the facilities are lovely here, and the staff work well as a team.
I'm James Moore, I'm the physio team lead here at Hinckley Hospital. What we're doing during COVID is one of the ways that we're trying to look at how we can optimise people's physical function and well-being is by providing therapy, potentially over a 7-day service. So we're exploring how that benefits patients, whilst also benefiting the well-being of our staff, being able to implement social distancing by spreading the staff across the 7-day working, providing a point of contact for families and relatives to update them on the progress of their therapy over the full 7 days. So far there's been really fantastic feedback from patients and staff. It's been a real benefit, and the ward have really appreciated the therapy presence throughout the week. So we'll be looking and seeing, can we take this out from when COVID and lockdown is eased, and how this may benefit our patients going forward in the future.
Patients who are being discharged are very grateful for the care that they have received. It's quite overwhelming. We've had lots of cheers and applause as people leave the ward after their recovery from COVID.
So we've put the wobble room together. It's somewhere that anybody can come if they're just having a little bit of time of uneasiness. They can come in here, there's hot drinks, we've put some beautiful pictures up from the children locally, and it's just somewhere you can come and just relax and chill out. We've put some colouring out and some reading and some books and stuff, but it's just somewhere you can come and have quiet time if you just think you need it while you're on shift.
We've had a lot of anxiety from the patients, obviously with the no visiting rules. It's been quite challenging. We've used resources like FaceTime, so we've been able to FaceTime families, which has kept each other in touch, which has been really lovely.